Welcome, everyone. My name is Joe Sabia, and I'm a chairman of the economics department and director of the Center for Health Economics and Policy Studies at San Diego State University. I'm pleased to welcome everyone to part 2 of Global Action's free webinar titled The Integral Role of Economic Research on the Electronic Nicotine Delivery Systems Marketplace. We have a fantastic panel of economic experts who will be discussing their research, and it's my privilege to introduce briefly each of them at this time. James E. Prieger is professor of economics in the School of Public Policy at Pepperdine University. His research interests include the economics of tobacco harm reduction, including optimal tobacco taxation. Donald S. Kenkel is the Andrew Dixon White Professor in the Department of Economics at the Jeb E. Brooks School of Public Policy at Cornell University. He is past president of the Society for Benefit Cost Analysis and has had teaching and research interests in cost-benefit analysis over the course of his entire career. Alan Mathios is a professor in the Department of Economics and the Jeb E. Brooks School of Public Policy at Cornell University as well. He served as dean of Cornell's College of Human Ecology from 2007 through 2018 and is co-editor of the Journal of Consumer Policy. So the format of this webinar will be as follows. Dr. Prieger, Dr. Kenkel, and I will present our research for up to 15 minutes each. Panelists are welcome to question each other, and Dr. Mathios may offer some comments throughout. During our presentations, I encourage those of you attending this webinar to click the Q&A function at the bottom of your Zoom screen. And in the final 10 to 15 minutes of this 1-hour webinar, we will present some of your questions to members of the panel and hope to get nice responses for you. So to begin, I want to introduce Jim Prieger, who's going to discuss evidence on whether e-cigarettes serve as a gateway to riskier tobacco behaviors or may divert riskier behaviors. And in addition, he's going to give us a sense of what types of regulations are more or less likely to achieve their policy objectives. Jim, the floor is yours.
Okay, thank you. So while I'm sharing my screen, let me just mention that I will be talking about some of my own and others' research, but really you can also think of this as just being an econometrician's, an economist's thoughts on the state of the literature as well. So the first topic that I wanted to picking up from the previous seminar, is really to get at this fundamental question of, does vaping causally lead to smoking? So let me just present the fundamental empirical puzzle that I'm sure most of you are familiar with. The first fact is that e-cigarettes, ENDS, do help people to quit smoking in many randomized controlled trials, even when they're not particularly motivated to do so, which is a very important fact. The second fact, however, is that when you look at people's usage of nicotine products over time, you do find a lot of people, especially young people, beginning to use vapes and eventually progress to smoking. And then you also find a lot of people that both vape and smoke and continue to do so, dual users. So there's really 3 hypotheses delineated in the literature here. These are not exclusive, different. One of these might affect different people. The first is just the gateway hypothesis. This is the one emphasized by the anti-vaping crowd. This is just the notion that if you vape, then that provides a gateway and a causal way to lead you more likely to smoke. The diversion hypothesis says the opposite. This says that, well, today's kid vapors are yesterday's kid smokers, and so we should actually be happy that they're being diverted into a less risky activity. And then closely related to the diversion hypothesis is the so-called common liabilities hypothesis, which just says, well, really, if we think about this like econometricians, it has to do with unobserved heterogeneity, right? There are just unobserved latent factors that cause selection effects, so that the same type of person who would be vaping is also the same type of person who might be more likely to smoke, and vice versa. And just a quick example of where this shows up in one place in the literature, Professors Kenkel and Mathios and one of their co-authors have a good paper from 2020 that shows just all the issues involved with selection effects and the great entanglement of vaping and smoking, and how that really complicates coming to any simple results, such as saying vaping causes respiratory disease. That can be a very difficult econometric issue. So just some observations on these hypotheses. First is, because of what we just talked about, I would caution all of us to be skeptical of any study, at least that I've seen to date, claiming to prove that there's a gateway effect, because there are many studies, mostly by public health practitioners rather than, or statisticians rather than economists, who approach some claims, but really it's just based on fact 2 from the previous screen. Also, I'd say that the common liabilities hypothesis is almost surely correct, at least for some people to some degree, because we know from the hard scientific literature, there are parts of our chromosomes and genes that we have that are predictive of smoking. And so these are called Mendelian instruments. I haven't seen these yet used by econometricians, but if an econometrician could team with a geneticist and a great database, there would be a wonderful scope for some instrumental variables regression there to study smoking and vaping. But just one example of the common liabilities hypothesis, one of the few times it's been examined in the literature, is a paper that I did with Anna Choi. And we provide evidence for Korea that after accounting for selection effects with certain econometric methods designed to deal with endogenous treatment effects, when you start with a positive correlation between smoking and vaping, which you have in those data, after applying appropriate methods, that turns into a positive causal effect for vaping on cessation from smoking. And then the third brief observation is just that the diversion effect is likely to predominate the gateway effect at the population level. And this is just based on the mere fact that in most countries, you have so many more smokers than you have kids who regularly use ends or are addicted to them. So that just means under a wide range of reasonable assumptions, you're going to get more health benefit from smokers quitting than from vapors progressing to smoking. Now on to regulation for the rest of the talk here. So this can be really hard to study well, since these regulations are widely flouted. So just because the law is on the book or in your database, that doesn't mean that anyone's following that law. Second, as we talked about last time, and so I won't belabor here, you have to look out for unintended consequences. You can't just study the impact of raising vape taxes on vaping in isolation and think that you've captured the whole picture. And finally, I would just say I haven't yet seen, and I'm willing and actually hope to be corrected now or someday, that there aren't really any good solid econometric studies yet showing that stricter e-cigarette regulations are going to improve public health. The state of the literature right now seems to be that given the reduced risk with e-cigarettes and the fact that the main health-related impacts of vaping regulation seems to be to encourage more smoking, the opposite is likely to be true. Of course, that doesn't mean that there should not be appropriate regulation. So I wanted to take a few moments just to put some flesh on some of these notions. It's quite common at this point to start talking about UK as a good example of e-cigarette regulation. Instead, I want to talk about New Zealand. And a lot of what I'm about to say is based on a report that just came out from a group called Smoke Free New Zealand. And so the figures that I'm about to show you come from that report. So taking New Zealand as a case study, this is a place where they have embraced harm reduction. People in that community talk about the 3 A's of availability, affordability, and accessibility. So e-cigarettes are legally available to anyone as long as you're old enough to purchase them. They're affordable in the sense that they don't tax vapes. And thirdly, they're made accessible because there's public health messaging that try to convince smokers to switch. So they've really embraced ENDS as a tobacco harm reduction strategy. And the regulation, almost with a very few peers with regulators in other countries, the harm reduction voices were actually heard when they crafted the regulation. And so regulation was definitely intended to reflect the relative risk. Cigarettes have higher taxes, for example, and vapes do not have taxes. There's mass media campaign. There's a slogan, vape to quit strong. There's a website to prevent facts. The first thing the visitor sees when you go to that website, vaping can help you quit smoking. And if you can't read the fine print at the bottom that says basically click here, how to switch to vaping. Second thing you'd see, don't start if you don't smoke. And given the relative harms, that's the proper order of the messaging, I would say. Now, this is aimed at complementing traditional tobacco control, not to replace it. So the thing that they are trying to use vapes to do is to give smokers an appealing product to switch to, and just to get away from the more traditional quit or die approach. So what results did they have? Now, of course, as econometricians, we have to say we are looking at correlations here. So this graph doesn't prove anything. I do find it highly suggestive, and it is something that we also see in other parts of the world. We're still awaiting a good cross-country econometric exploration of these issues, and that's something that I would love to see happen by myself or others in the next few years. But if you look at smoking and vaping, you see just a wonderfully inverse relationship between the two. As elsewhere, smoking had been decreasing in New Zealand, but at a relatively modest pace until e-cigarettes hit the market around 2011, 2012. Measurement of vaping started happening a bit later, but basically you see sharp increase in vaping associated with a sharp decline in the rate of the decline of smoking. A sharp increase in the rate of decline in around 2019. So you can compare New Zealand to its closest large neighbor, Australia. So they do have some common regulations. For example, the age limit is the same. Can't advertise these things in general mass media. There are health warnings on packages of e-liquids, but there are some key differences. The biggest is simply this. In New Zealand, a vape is a consumer product. I could go down to a store and buy one. In Australia, I need a prescription from a doctor. Oh, and by the way, only 1% of doctors are licensed to prescribe them. So your doctor probably cannot give one to you, and actually probably does not even believe that vaping is less harmful than smoking. The median doctor in Australia, as in the United States, believes that vaping is just as harmful or more harmful than smoking, which is almost surely wrong given the scientific evidence. Flavors are available in New Zealand as long as you go to a specialty vape store. In Australia, just the big availability issue of anything flavored or not is just getting it. Messaging in New Zealand is vape to quit. Messaging in Australia is vaping harms you. And so you can see some typical messaging over there on the left from each country. So here's what you can say. Australia is basically the poster child for everything that the WHO would want a country to do regarding e-cigarettes. So for example, they don't have an outright ban, but they basically have all the policies in place. They have one of the highest tax rates, certainly on cigarettes, but also on vaping. The vape tax is increasing over time. No legal retail availability, consistently negative official messaging, little official encouragement to try vapes for cessation, unless you have one of those 1 in 100 doctors who might actually help you with that. So what are the results? So smoking had been worse in New Zealand and then Australia until recently. So you can see, comparing the solid blue and yellow lines, that Australia has actually lost its edge in smoking prevalence. More people smoke now in Australia than in New Zealand. Now, by the way, notice, even though it's nearly impossible to get vapes in Australia, there's a lot of people vaping. That's the dotted line in yellow. Well, what about the children? That's why all this is done, right? Look at the red line there. There's just as much youth vaping in Australia as in New Zealand. And importantly, it's declining in New Zealand. It's increasing in Australia. High prices, lack of availability. As economists, we know that illicit markets are substitutes for licit markets, and that's what they have in Australia. There's over 1 million adult vapors in Australia, but only 8% have a prescription. Necessarily, that means that all the rest are violating the law. Now, to talk about violence in Australia's illicit tobacco markets, we have to be clear. Much of this is driven by trade in cigarettes, but also by vapes. Their high tobacco taxes make trade in cigarettes a big deal as well. let me just mention briefly what's been going on there. So do this in kind of reverse order. In recent months, there have been over 40 examples of tobacco stores being firebombed. These are done by the gangs fighting over turf. This is big business. In recent twists, they've started to use teens to do these firebombing attacks. This law is not exactly protecting the children, or at least those children. Just more generally, if you are interested in hard econometric research, proving the link between higher taxes and illicit trade in tobacco, I have a paper on that listed there with a co-author. And then also just the general links between enforcement, illicit trade in cigarettes, and violence. I have some papers there as well, and you can come back to the video of this presentation if you want to look up those links. Okay, final slide. And just to set up some of what the others on this webinar will be talking about, I wanted to come back to this issue of flavors. Flavor bans are often cast as, oh, these appeal to children uniquely. They're just a plot to get children to vape. So if we ban them, but leave e-cigarettes otherwise legally available, maybe that will solve the problem and we'll get all the benefits of e-cigarettes. Well, we'll see. So these are regressions that I ran using data from the United States from a couple of years ago. This is in the book of mine that just came out on e-cigarette regulation. So notice what you are getting here. So we have the age of the user on the x-axis, and then the probability that that person uses flavors on the y-axis. And you can stare at these for a while to figure out the graphs, but what they are showing is simply this. It's in the subtitle. If you're in the US and you vape, and you're under 70, in other words, almost all of the vapors, you are more likely than not to choose flavored e-cigarettes. Okay, so yes, it is true that flavors are appealing to youth, but they are not uniquely appealing to youth. And so, final sentence, if you want to help people turn to an appealing product to quit smoking, flavors could be very important. And I will stop there. Thank you.
Thank you so much, Jim. I appreciate that. So I'll now exercise a bit of the privilege of the moderator to seize some time and talk about our team's research in the public policy area that will build nicely on what Jim was just talking about. Share my screen. All right. So I'm going to present some work our team has done on the intended and unintended effects of restricting access to e-cigarettes. I'm going to talk about three sets of public policies in the areas of e-cigarettes. That is, ends flavor restrictions, building on what Jim just spoke about, ends licensure laws, and taxes. So the first study I'm going to talk about was released by the National Bureau of Economic Research about a week ago. It's joint with a great team of co-authors, Chad Cotty, Chuck Quartermanch, Catherine McLean, Yang Liang, and Eric Nessen. In this paper, we look at the effect of e-cigarette flavor restrictions on tobacco use in the United States. And I'll start with a quote from Truth Initiative, which says that the tobacco industry is well aware that flavors appeal to and attract kids, and that young people are uniquely vulnerable to nicotine addiction. They argue that we all must work with ever greater urgency to protect our nation's youth from all flavored e-cigarettes, including disposables. Now, in 2009, a federal law was passed, the Federal Smoking Prevention and Tobacco Control Act, which banned the sale of flavored combustible cigarettes, with the exception of menthol, which some states have banned subsequently. But it didn't restrict the sale of other flavored tobacco products, such as e-cigarettes. And according to the National Youth Tobacco Survey, in 2023, nearly 90% of youth ENDS users reported using a flavored variety of ENDS, the most popular being fruit, candy, desserts, sweets, mint, and menthol. There is still some ongoing scientific discussion about whether the chemicals in e-flavors are safe for ingestion. That is, whether these flavors heated at various temperatures and inhaled in an aerosols type form is going to be healthy. I'll skirt that scientific debate, but we can return to it in the Q&A section if folks want. But what's clear is that at least some e-cigarette regulators believe that restricting access to so-called youth-appealing flavors is going to be an important tool in curbing teen ends use. So with that goal, 9 states, the District of Columbia, and over 370 sub-state localities have adopted regulations that restrict the sales of flavored e-cigarettes. Minneapolis, Minnesota was the first large city in the U.S. to adopt an ends flavor restriction in January 2016, while Massachusetts was the first to adopt a statewide law in late September 2019. So our team used repeated cross-sectional data from the state and national youth risk behavior surveys, which survey U.S. high school students, and on young adults and older adults from the Behavioral Risk Factor Surveillance Survey, and exploit geographic and temporal variation in the adoption of ends flavor restrictions to look at how these laws affect youth and young adult tobacco use. So we focus on statewide laws and laws that were adopted by large jurisdictions, that is, cities and counties serving over 200,000 persons. So by 2017, we had sub-state jurisdictions in Minnesota and Massachusetts had adopted these laws. And here you can see the policy rollout over time, such that by 2021, we had some states in the Northeast, the West, and the Midwest that had adopted these laws. The dark-colored states, the black-colored states, are those that had adopted statewide restrictions by 2021. So what did we find? We find some evidence of an intended effect of these flavor bans. I'm presenting results here from dynamic difference in differences models or event study analysis. The vertical red dotted line denotes on the left side the pre-treatment period, and to the right of that vertical red dotted line is the post-treatment period. And here I'm showing you conditional differences in the ends use rate in treatment and control states before and after the flavor restriction. And what we find is evidence that the adoption of this law is associated with about a 1 to 2.5 percentage point decline in frequent and everyday, that is more habitual, ends use among adults. That's about a 30 to as high as 60% decline relative to the pre-treatment mean. So that's in the far left graph on your screen. The two far right graphs are showing you that we find a similar pattern of results among young adults, that is older teens, ages 18 to 20, where we find ends flavor restrictions associated with about a 2 to 5 percentage point decline in ends use among young adults. So while it's true that some of these teens may substitute to unflavored ends in response to ends flavor restrictions, on net, ends use seems to decline, which is the intended effect of the policy, what some public health advocates had hoped to see. We don't find much evidence that ends flavor restrictions affects ends use among adults ages 21 and older. There could be a few reasons for that. One is that adults are at least somewhat less likely to use flavored ends than teens, but another is that adults may be using ends for a different purpose, that is for smoking cessation, whereas the flavors may be more likely to be complements to the ends for youth. So that's the good news. The bad news is we find some unintended effects of ends flavor bans on combustible cigarette use. So we find evidence consistent with a hypothesis that flavored ends and combustible cigarettes are substitutes, particularly among older teens, where we find that ends flavor restrictions are associated with about a 1 to 2 percentage point increase in combustible cigarette smoking among 18 to 20-year-olds. So this is clearly bad news in terms of the tobacco-related public health effects of ends flavor bans, and certainly would tend to undermine the public health objectives of these laws. So this was our NBR paper on the left-hand side with this great team of authors. On the same day we released this paper, another great team of authors, Henry Saffer, Selin Ozgadin, Mike Grossman, Daniel Dench, and Dhaval Dave, released a paper on comprehensive e-cigarette flavor bans and tobacco use, and using a similar set of methods found a very similar set of results. So I want to strongly encourage you to read their paper as well. We're big fans of it. We've heard that they like our paper as well. So we're excited about these important contributions to social science on the early impacts of e-cigarette flavor bans and their unintended consequences. The second policy I wanted to highlight involves e-cigarette retail licensure laws. This paper was also released by the NBER a few weeks ago. It's joint with Chuck Quartermanch, Catherine McLean, Katerina Muratori, and Yang Liang. So this paper looks at a supply-side policy intervention designed to curb access to e-cigarettes, that is retail licensure laws. They have been adopted since 2011 by 33 states and the District of Columbia. E-cigarette licensure laws require sellers to obtain a state license in order to sell e-cigarettes over the counter, and failure to comply with obtaining a license or keeping it up to date can result in penalties that can occasionally be criminal as compared to civil penalties, and fines of up to $25,000 for violations. Now, the goal of these licensure laws is to regulate state sales of e-cigarettes, to increase compliance with state tobacco regulations, including minimum legal purchasing ages for e-cigarettes, and reduce the supply of e-cigarettes that are available to consumers, in particular youth. So the goal is that by exposing retailers to greater scrutiny by state regulators through compliance checks, we may see sort of greater enforcement of things like minimum legal purchasing ages. And many public health experts see licensure laws as a vital anti-vaping policy. So for instance, in 2018, the US Surgeon General issued an advisory recommending that states and localities adopt licensure laws as part of a comprehensive approach to curb youth vaping. And there are some good reasons to imagine that these laws could be effective if they're resulting in stronger enforcement of minimum legal purchasing ages, if the costs of compliance are causing some retailers to stop selling e-cigarettes, that could result in a negative shock to supply, increasing the local price of e-cigarettes. Some of these costs could be passed along to consumers in the form of higher prices as well. On the other hand, there's some reasons to imagine that licensure laws might not be as effective as we hope. For instance, the cost of an annual renewable e-cigarette license is on average between $25 and $50, the highest cost generally in the $100 to $200 range. If you think that's a relatively small cost for the right to sell e-cigarettes, maybe these are not going to have much effect on prices or local supply or compliance. But it's also true that most youths who use ENDS don't typically get their e-cigarettes by buying them directly from a retailer. So these are data from the Youth Risk Behavior Survey among youth ENDS users. Less than 20% of youth ENDS users usually obtain their e-cigarettes by directly purchasing them from a retailer. For the most part, youths are obtaining their e-cigarettes through informal social sources, such as bumming and borrowing their e-cigarettes from others, getting them from someone else, or in some other way. A growing share are getting them from the internet, but it's still small, less than 5%. So in 2011, there were no ENDS licensure laws in the US, and this is giving you a flavor of their rollout over time, such that by 2021, the average person in the US lived in a jurisdiction that had an ENDS licensure law. We also focused on licensure laws that had higher penalties for compliance, criminal penalties, higher renewable licensure fees, to see whether any of these state laws had much of an effect on youth and young adult ENDS use. What is our punchline? Again, here is a dynamic difference in differences plot. We don't find any evidence that ENDS flavor restrictions reduce youth ENDS use. In fact, our estimates are sufficiently precise such that with 95% confidence, we can rule out licensure law-induced youth ENDS use declines of greater than about 3.5%. So it doesn't look like these laws are particularly effective at curbing youth ENDS use, in contrast to what some public health advocates had hoped. And this is true even if we look at licensure laws that had higher penalties associated with them. There's only one group for whom we do find some evidence that licensure laws, particularly high penalty licensure laws, might be effective in curbing ENDS use, and that's among Black teenagers, where we find that licensure laws associated with higher penalties for non-compliance are associated with about a 1 to 2 percentage point decline in ENDS use. So there could be a few reasons for this. One is there could be a higher degree of enforcement of licensure laws in the Black community. That is a race-specific sort of targeting of enforcement. Second, it could be that compliance costs are relatively higher for small businesses that are selling ENDS in the Black community. And we can certainly have a discussion about whether this result is a good thing in terms of public health or not, but it's a disparities result we thought was important to highlight. I'll close with a brief discussion on ENDS taxes. In a series of papers, my co-authors and I have looked at the spillover effects of ENDS taxes on combustible tobacco products, but also on non-tobacco related health behaviors, which we think is really important. So 31 states in the District of Columbia have adopted ENDS taxes, but assessing the efficacy of ENDS taxes is going to require evaluating whether the tax optimally corrects for market failures like internalities, externalities, information asymmetries. And that in part is going to require us to evaluate not only own price or own tax effects, but also cross-price, cross-tax effects, including for other health behaviors that may themselves generate externalities and internalities. So Minnesota was the first state to adopt an ENDS tax. Again, this is giving you a flavor of the rollout of ENDS taxes. The deeper colors are showing where the higher ENDS taxes per milliliter of e-liquid have been adopted. So for this set of studies, we're exploiting geographic, temporal, and sort of the intensity, the magnitude of the changes in the tax to identify treatment effects. In a paper in the Journal of Health Economics, Rahi Abouk and colleagues found evidence that ENDS taxes did have their intended effect on youth ENDS use. A $1 increase in ENDS taxes is associated with about a 2 to 7 percentage point reduction in ENDS use. So that's the good news. We find that across both the Youth Risk Behavior Survey and the Monitoring the Future survey. The bad news is that we also find evidence of a substitution effect, like we found for flavor ban policies. We find that a $1 increase in the ENDS tax is associated with about a 1 percentage point increase in combustible cigarette use, again tending to undermine the tobacco-related public health goals of raising ENDS taxes. We also, though, think it's important to look at spillover effects of ENDS taxes on non-tobacco related health behaviors like alcohol and marijuana, which could be complements or substitutes for e-cigarettes or combustible cigarettes. Why? Because things like alcohol misuse, particularly among teenagers, is really costly. And some of these costs are privately borne by problem drinkers, but some of them are external in nature as well, including traffic deaths to others, alcohol-induced violent crime, and addiction-related internalities. But the social costs, particularly of alcohol misuse among less experienced drinkers, teenagers and young adults, is quite high. And on this slide, you can see the magnitude of some of these costs. So looking at the spillover effects of ENDS taxes on alcohol misuse, and on marijuana, we think is important for assessing their full welfare effects. This is what we find when we look at the effect of ENDS taxes on binge drinking. as well as alcohol-related traffic fatalities, we find some evidence that increases in ENDS taxes are associated with a reduction in binge drinking among teenagers and young adults, which is consistent with the hypothesis that e-cigarettes and alcohol are complements. We tend to rule out an income effect story and lean more to an economic complement story for these results. And we also find some evidence that suggests that ENDS taxes could reduce alcohol-related traffic fatalities as well. We find a similar pattern of results for marijuana, maybe particularly for experimental marijuana use, which may not be a big deal for adults, but for younger teenagers, early initiation into marijuana use is pretty bad for brain development and cognitive development as well. So these are potentially some non-tobacco related public health benefits that could arise from ENDS taxes that we think are an important part of the welfare analysis on the efficacy of ENDS taxes. So that's our set of papers on some of the tobacco and non-tobacco related costs and benefits associated with e-cigarette regulation. And I will stop sharing my screen and thank you all for indulging me. And I now want to turn the floor over to Don Kenkel, who's going to be talking about benefit cost analysis in the context of tobacco regulation. Don will be discussing a framework for how to think about whether particular vaping regulations correct for market failure and help direct resources to a more highly valued use. Don, the floor is yours.
Oh, thank you very much. And this is I'm going to pick up on several issues that have come up in James's talk and Joe's talk as well. And the introduction that Joe just gave me was perfect. I mean, about framing what benefit cost is all about. So I think that's a very important part, is if you're really getting your head straight about how to think about the cost and benefits of tobacco regulation. But before I even say that, let me just back up for a second and mention that when you talk to people about doing benefit cost analysis of any regulation, sometimes people think, well, how can you put these dollar values on these outcomes? Isn't that the hard part? And I actually think that in a lot of situations, and again, this cuts across on, I've read analyses of lots of areas in environmental regulation, health and safety regulation other than tobacco and so forth. The hard part is actually determining the causal effects of the regulations on these outcomes of interest. And so it's all the discussion that James Prieger had earlier and Joe's work as well, these econometric studies of if you put this regulation in place, what happens? That's a really difficult empirical question. And again, I think that's sometimes the hardest parts of these questions. And when you read a debate about are the benefits of this regulation or that regulation, be it again, the Clean Air Act regulation, are they worth it? Are the benefits, are the costs worth the benefits? A lot of times the big debate will end up being actually, well, what did that regulation have effect on human health, not on how are you going to put a dollar value on human health. So with that, so that's just to, again, underline, I think, how important all the work various teams are. And I also, and Alan Mathios and I also try to do a lot of empirical work to determine sort of the facts of what happens. Now, the cost benefit analysis takes it to the next step and says, in addition to the facts of what happens, we're going to try to help decision makers make a normative judgment about whether this policy is a good idea or a bad idea. So hopefully, again, econometricians and maybe others have established a set of facts of what this policy does. We say, well, should we enact it? Now, economists don't pretend that cost-benefit analysis provides all the answers. It helps the decision-making process. One person always likes to say it's not dispositive, which is kind of a lawyerly word. And this woman is a lawyer that was the head of the regulation office at OMB. But what of course she meant was that it doesn't make all the decisions. In fact, it focuses in on a very specific criterion that Joe mentioned, and that is that economic efficiency are resources in their most highly valued use. And because under a set of conditions that, again, economists are very familiar with in terms of setting up how the economy works overall, under a set of conditions, when markets work, they tend to allocate resources to their most highly valued use. So the question really becomes, are there market failures? Are there things that are keeping markets from getting resources to their most highly valued use? And again, to put that in context of a regulation, to ask, does this regulation fix a market failure and therefore get resources to their most highly valued use? Now, note that's not the only question people ask about tobacco regulations. And in fact, because it's part of the Health Department of Human Services, the Food and Drug Administration, the US, and in many other countries, think of tobacco regulation as part of a public health question. Does this regulation improve public health? Sometimes, by the way, earlier, I guess, before public health, some of the discussions of taxes, we have this older terminology, we call them sin taxes, because the question was not really even necessarily about public health, but just, hey, some things are bad people are doing. Can we discourage people from doing those bad things that society has determined are bad? I don't think there are too many places where that's really driving tobacco regulatory policy, but sometimes it does. Sometimes, this idea of, all we have to do is see, has it decreased smoking and vaping? That's not the right question even for public health, but certainly not the right question for economics. Other perspectives, especially on taxation, is, what does the policy do to government finances? And I've also seen a set of new research coming out kind of in the public health world that is adopting some terms from economics, asking sort of, well, what does this regulation do to an individual's budget? Sort of emphasizing that, households, especially poor households who are disproportionately smokers, if we do this, what happens to their budget? How much do they have left over to spend on everything other than tobacco? Again, that's not exactly the same question that the economists are asking about what the economic efficiency of. And to try to drive that home, I'll just repeat an example that I feel like almost every economist I've spoken to that have taught these things to undergraduates has used, and that's traffic safety. What would be the public health maximizing approach to traffic safety? Well, we would all drive, we'd have a national speed limit of 5 miles per hour, and we'd all drive in these tank-like vehicles, and we'd have very few traffic deaths, but we'd impose lots of extra costs. And so that sort of suggests, well, maybe maximizing public health, minimizing traffic deaths can't be the right answer here as far as economic efficiency goes. And so economic efficiency recognizes that consumers have all these other valued things, that yes, they don't want to die, but yes, they also don't want to spend a week and a half driving to grandma's house, and yes, they don't want to the more comfort, and then even sheer enjoyment of driving with a convertible on the top down, or a motorcycle. And this, there's some very excellent work on motorcycle helmet laws along those same lines. But to stop my digression from this is just an example to suggest that, the point is that it's just maximizing public health is not what an economic cost benefit analysis is going to do. So what we start off with is saying, okay, what's the market failure that we're fixing? If this regulation is trying to fix a market failure, what is it fixing? And in the tobacco area, one obvious market failure, especially for smoking, is secondhand smoke. This is a classic externality where what I'm doing, smoking this cigarette, is imposing cost on other people around me, and not just discomfort, unpleasantness, which I happen to hate the smell of tobacco, but also physical damage to my health. And this has been, proven, well proven that there are harms to secondhand smoke. So there's this classic externality, and you could say, okay, so we can impose, smokers are imposing cost on third parties. How can we correct that? Now, this brings to the next point, though. We have to look at, if we're thinking about a new regulation, we have to think about the world as it is, including current fixes. In the US, for example, we have a lot of laws that ban smoking in public places, and there's been steady progress, and this has been proven by a series of studies using data like from the National Health and Nutrition Examination Survey, where you can measure non-smokers' exposure to secondhand smoke, and it's been steadily declining. So we've really done a bunch of other policies to fix that externality. There are some remaining, that we haven't driven secondhand smoke externalities to zero. So there are there's a small remaining externality, but it's important to remember that those other policies have already fixed that. Probably the biggest focus these days on tobacco regulation arguments goes around not externalities, what people are doing to third parties, but internalities, things people are doing to themselves because they're not perfectly rational and well-informed. And that's probably the biggest area of tobacco regulatory cost-benefit research, is trying to determine how big these internalities are and then what they have to, what implications they have for tobacco regulations. Now, again, for adults, there's been some work that has tried to estimate some internalities. And here I'll mention two papers that I've done with a couple of different sets of co-authors. One would just be a general summary of a lot of this work published in the Journal of Economic Literature by Phil DeSica, myself, and Mike Lovenheim, that reviews tobacco regulation very generally. And I've also published a work with Lawrence Jin, myself, Hua Huang, and I believe Feng Liu, in the Journal of Cost-Benefit Analysis, which also sort of works through, did a retrospective analysis of how tobacco policies in the US have corrected internalities in the US in terms of smoking. And one of the most obvious internalities 50 years ago, which is where our study started in that Journal of Benefit Cost Analysis, was that a lot of people were not well informed about the health consequences of smoking. So people were imposing cost on their future selves simply because they didn't know that what they were doing was going to give them lung cancer, was going to give them COPD and heart disease. That information problem has been largely solved again in the US and many other high-income countries, and pretty well, a lot of progress is made in lower middle-income countries as well. So the average smoker, an average person in the US, the average smoker in the US, has an accurate perception of the risk they're imposing on themselves. The next question, the harder question, comes down to, well, can it be rational that they're making that choice? Is there some other problem with their decision making that is causing them to make decisions that are not in their own best self-interest? And the usual story there is psychological research and behavioral economics research suggests that people are present biased. They sort of pay a lot of attention to what's going on in the present, and they tend to sort of too heavily discount the future. There are rational reasons to discount the future, but if you pay sort of no attention to tomorrow and all of your attention to today, that could be some evidence of behavioral biases. And again, that would generate some ideas of that there could be internalities related to smoking. Now, again, in the Journal of Economic Literature paper, we review the estimates of internalities and externalities for smoking and conclude that, a lot of the policies have actually pretty well fixed a lot of those problems in the US context, at least. So let me finally get to vaping regulations, very specifically. When we think about vaping regulation, here the empirical problem becomes harder, because we are thinking about, as Joe was pointing out with his evidence of his research and others, we have two closely related goods that we think what we do to cigarette might affect the vaping, and we think what we do to vaping might affect the cigarettes. Now, again, market failures are key here. We could say the same thing true about apples and oranges. If I start regulating apples, orange sales will change. If I start regulating oranges, apple sales will change. We don't really care about those because they don't have market failures. And there's no extra benefits or cost to society of the changes in these other markets. But in particular, if we change, vaping and smoking, if they're still uncorrected internalities or externalities, then that has to be an extra term in our benefit cost analysis. So that's why it's very important to determine what a vaping regulation does to smoking. And here we're building pretty much in the same, we have some common ground here now with the public health research or the approach of maximizing public health. If a vaping regulation makes it harder for adults to quit smoking because they're no longer getting the, for example, the flavor they like, and again, this is consistent with the newer research that Joe was mentioning, then it's going to be bad for public health because it's going to push people from a lower harm product into a higher harm product. It's also going to be bad for cost benefit analysis in terms of there's going to be this extra cost that we'd have to take into account from the uninternalized part, the mistakes, the failures that people are still making in the cigarette market. On the vaping side, we also have to think about the market failures. But here, it really gets tricky because, again, we might think, and I think a lot of people might agree with this, that youth decisions about vaping might be due to this, present bias. They're not making decisions in their own best interest over their whole lifetime. And, whatever we think the harms of vaping are, we know lots of science establishes that the vaping is much less harmful. But if there's any harm, or plus just some potential harm, plus just the addiction and the fact that you may end up, the money you're spending just to sort of factor your addiction, you might say, okay, so vapors are imposing cost on their future selves. They've made some bad decisions there. And that would be part of the benefit cost analysis. So things we can do to keep kids from vaping would show up as a social benefit and a benefit cost analysis. But the flip side, or not the flip side, but the other market then becomes really important. What happens to adults, and especially to adults smoking, and taking into account that so many adults successfully use vaping as a way to quit smoking and reduce the harms to their health. And at that point, we have to also bring in another market failure, which kind of works in a different direction. And that is, there's a widespread misperception that vaping is as harmful or more harmful than smoking. And we've documented this, others have well, like Professor Kip Viscusi from Vanderbilt University, that suggests, well, people seem to be pretty accurate about their understanding of the risk of smoking. They way overestimate the risk of vaping compared to sort of any reasonable estimate of what those risks are. And as a result, there's already a problem that people are making the wrong decisions from this economic efficiency view, from the view of their own lifetime utility maximization. They're making the wrong decisions about vaping versus smoking because they think vaping is as dangerous or more dangerous. And so with that market failure as well, it really it generates an important extra cost potentially to a vaping regulation, because there's already a problem there where the market's been distorted by this lack of information. Now, the final thing I'll mention, I actually hope to be able to have a little bit more time, but I want to leave time for comments and questions, is another aspect of benefit cost analysis is that it allows for a systematic analysis of these unintended consequences of policies that may have nothing to do with the main point. And I think this is one important class of unintended consequences of tobacco regulations are creating illegal markets. And again, that's an empirical question. Does it create an illegal market? How big are they? That's an important part of the analysis. And that question will also have implications for the other impacts. Will a vaping regulation really have much of an impact to reduce teen vaping if it doesn't actually take the cigarettes off the market because they're still available in the illegal market? But the other aspect that cost benefit analysis can bring in and can say, let's look at the cost and benefits, or the extra cost generated by these illegal markets. And there's one set of costs, again, they're kind of externalities that illegal markets by their nature tend to be violent. So you can have, a lot of times illegal gangs get involved in this distribution of illegal products. And if you make a new illegal product, you could therefore, sort of expand gang activity, expand gang violence. Another issue that's very concerning, especially at least in the US, recent events over the past 5 years or so, is the problem of police violence in enforcing laws like this. And it goes back, has a lot of salience for tobacco policy, because one of the terrible killings by police was of Eric Garner, who the New York City police had apprehended on suspicion of selling illegal cigarettes. And then they put him in an illegal chokehold and he passed away. And that type of extra cost is certainly something that is of great concern when we think about prohibitions of policies. Another aspect, by the way, is just that illegal markets also create extra cost for the consumers themselves. And the fact that they're exposing themselves to all these potential extra inconvenience costs and illegalities. And so actually, as a general rule, if you're going to do something, I'd rather see you tax things than try to than regulate, than prohibit them. Taxation is generally better than prohibition. So I'll end with that.
So Don, we had a question just sort of pop up that seems most relevant for you. The question is, how do we factor in the intention theory of decision making and regulatory capacity of government when doing cost benefit analysis?
I'm not quite, the intention theory of decision making, I'm not 100% sure if I'm interpreting that correctly. But if we're talking about how intentional people are in making decisions, I think that this fits into this general issue of, are people making decisions in their own best self-interest? And so we'd certainly want to factor that into account. Though this does, and I'll just emphasize that once we start bringing in considerations like this, we're talking about the government adopting a paternalistic policy, a paternalistic approach. And the guiding principle of cost benefit analysis is consumer sovereignty, that we want to do things that, some things decisions are made by the government by regulations, but we want to be, how would the consumers, if they were making those decisions, choose them? And that you can still apply that to a paternalistic policy, saying, well, my slow thinking rational part says this is really what I want to do. And so I can even agree that, yes, this policy that keeps me from smoking or vaping is in my own best self-interest. But that's a very difficult question. And so I think when you go to these paternalistic policies, and other experts like David Weimer, who's a very famous benefit cost analysis out of Wisconsin, or Douglas Bernheim, an economist at Stanford University, suggest we should have a very high bar before we start throwing out the idea that people make decisions in their own best self-interest in favor of the idea that governments can make better decisions. And that's actually another really interesting area of research, is that governments are run by people too, who also have their own behavioral biases. And so if consumers are making bad decisions, regulators might also make bad decisions. And so it's a very difficult problem.
No, thank you, Al.
So,
Alan, you want to jump in?
I just wanted to sort of reflect on the discussions today. So I really thought both Jim and Joe, you did a nice job using econometric methods, using observational data to try to get at flavors and unintended consequences. And I just wanted to note that Don and I and colleagues have done studies using stated preferences, not revealed preferences, in Australia, China, Japan, UK, Sweden, Indonesia, Malaysia, US. And one of the most common findings in that experimental data, where you don't have the complex econometric identification issues, are two primary results that are very consistent with the results you found. One is that raising e-cigarette prices moves people away from e-cigarettes and towards cigarettes, with some quitting in some countries, not all countries. But we do find this very consistent cross price effect onto cigarettes, and reducing the available number of flavors also does exactly the same thing and moves people away from e-cigarettes towards cigarettes. So it's kind of quite interesting that both stated and revealed preferences are sort of giving very similar results. In fact, we're working on a project right now on Japan, where it's not e-cigarettes, but heated tobacco products, IQOS. And there we find that flavor availability is very important. And if you restrict flavors to just menthol and tobacco, you, you move people again away. You get no additional quitting, but you move people towards cigarettes. That's what our preliminary results from Japan show. The only other comment I would make about both of the empirical projects that were shown today is that I think using age cohorts or age distribution can add some insight. So in Jim's work, looking at those trends for different age groups where the gateway hypothesis is very different probably for youth versus older adults. And I saw that you had age 15 and above. It would be interesting to look at what those trends are, comparisons of e-cigarette use versus tobacco use over time for different age groups. It might hint at things about the gateway hypothesis. And in Joe's work, I thought it's interesting. I wonder if your results are stronger in states where there's not easy cross access to purchasing flavored products, because some states are very close to other states where it's very easily available. And especially for younger people driving, and the ability to cross state purchase might be very limited. So there seems to be some age exploitation, and I don't mean exploitation in a negative way, using age as a way to get further identification in some of your work. And those are my comments based on what I saw today.
Yeah, that's great. We're rapidly coming to a close, but I do want to ask one sort of final question, and it's, basically, despite some evidence of positive effects of ENDS access on smoking behavior and on public health, what do you think the primary reasons are for why policymakers across a number of countries throughout the world, including Australia, as Jim talked about, for clamping down on e-cigarette access? Why ignoring a lot of the empirical evidence? What are some of the political economy sort of reasons for what's going on in a lot of countries around the world? Why don't economists have more influence?
That's a great question. I wish I knew the answer. I mean, I think, as I said, actually, part of it could be sort of a behavioral economics story about policymakers. Regulators can have, it's very salient to think about what's going on with teens. And I know this played out, for example, in the U.S. when there was new numbers coming out about a youth vaping epidemic that also happened to coincide with the Valley lung injuries that actually had nothing to do with vaping nicotine e-cigarettes, but those two things came together, they got conflated, and there's a big political push to do something. And so let's ban the e-cigarettes, or at least regulate them, or regulate the types of e-cigarettes that seem to be behind a lot of I think there's a lot of salience to that. And these classic political economy story is, if we can impose cost on a lot of people, some of whom we don't even know they're imposing costs, all sorts of adult smokers, some of whom, I think, as James was pointing out, when they start trying e-cigarettes, they weren't even thinking about quitting, but they get this unintended benefit that they decide to quit. Now they're not going to necessarily campaign against or vote against politicians who are dealing with saving the kids through an e-cigarette regulation, but we are imposing cost on them. So that's my 2 cents worth.
I appreciate that. Thanks, Don. Well, we're about out of time, so I want to take this opportunity to thank our panelists, members of our virtual audience, and of course, Global Action, who made this webinar possible. And in particular, I want to thank Ida Urekli, who helped organize this event, and Evan Hahn, Nicole Bradley, and Mino Drumheller for their media-related and technical assistance on this webinar. Thanks to everyone, and we look forward to seeing you at our next webinar. Thanks.